Hi guys, my name is Shelby, and this is my presentation on GLP-1 medications, and this is for my Applied Allied Health Concepts class. And today we're going to be taking a deeper look into GLP-1s and into this new world of healthcare and the skinny life, if you will. So, to start off, I thought I'd give an introduction about what GLP 1s are. So, GLP 1s are receptor agonists. They are a class of medications that mimic the natural hormone glucagon like peptides. So, these are released in the gut after eating. And this hormone plays a key role in regulating the blood sugar by stimulating insulin release. And then this also suppresses that glucagon secretion and it slows gastric emptying. And then it also promotes that feeling of being full. So, because of these effects, GLP-1 medications also help lower blood glucose levels and reduce oral or caloric intake. So, you always see those commercials on Ozempic or different like Mounjaro. Those ones are always advertising how you always see lower A1C levels and lower your blood glucose levels. That's kind of what that's talking about. So originally, the GLP-1 receptor agonists were developed for the management of type 2 diabetes, kind of how I just mentioned. But they're effectively improving glycemic control with a lower risk of hypoglycemia, which is low blood sugar, compared to some of the other medications that are used in modern day medicine. So over time, their ability to promote significant weight loss has led to their approval and widespread use for obesity treatment, even in individuals without diabetes. So, GLP 1 medications are expanding beyond their original roles in weight loss and diabetes management. So, showing growing potential in the treatment of cardiovascular disease and kidney disease, addiction, and other health complications is something that GLP 1s are starting to improve on. So, GLP 1 receptor agonists are medications that basically copy that natural hormone in our body called GLP 1, which is released after we eat. So, this helps regulate the blood sugar and then our appetite as well. So these medications, they essentially help the body release more insulin when it's needed, and it reduces glucagon, which prevents blood sugar from getting too high. At the same time, though, they do slow down pretty quickly, and that's when the stomach empties, which then makes people feel full. So that's that gastric emptying. Because of these combined effects, they've become really effective not only for managing type 2 diabetes, but also for promoting weight loss. Another important point is that they actually come in two different forms, and that is injectable and oral. And this gives different patients and clients more flexibility depending on their preference and their needs. So this is a graph that I have pulled from a resource that I'll show at the very end of the slides here, but this shows how GLP-1 medications among different adult patients have increased from there on the left, 2019, clear up to 2024. So I'm sure in today's date, 2026, that there are more significant numbers that are being used. So at that teal line there, we've got just any GLP-1s in general. Green is Ozempic, pink is Mounjaro, and then yellow is three different ones. So that's Wegovy and Zepbound, and those ones are becoming quite popular today as well. So you can see that noticeable rise, especially in obviously these more recent years, and it reflects increased awareness, doctors prescribing these, and the acceptance of these medications as a whole. So these drugs that I kind of mentioned, Ozempic and Mounjaro, they have contributed to this specific trend, if you will. And it's particularly used more for different benefits beyond the weight loss, kind of like I was talking, and but beyond diabetes as well. It actually helps with cardiovascular protection and have been more well known for that now. So, this trend really supports the idea of GLP-1 medications and how they're becoming more widely used and are more likely to continue growing in both clinical practice and everyday use. Okay, so jumping right back into those cardiovascular benefits here, we've got a couple of different points here. So, one of the most important emerging benefits of those GLP 1s, kind of how I've been talking about, is cardiovascular health. So, studies have shown that these medications actually reduce what we call the major adverse cardiovascular event, or MACE. And this includes heart attacks, strokes, and any other cardiovascular related death. So we have there's different surgeries and everything that people get for those as well. So overall, research suggests that about 13% reduction in these events, which is pretty significant actually. It's especially in the high risk populations. Because of this, the GLP 1 medications are now commonly used in patients who have type 2 diabetes, obesity, or even an elevated risk of cardiovascular disease. And that could be predisposition, meaning like genetic. So there's still ongoing research going on in this area, though. There's other organizations like the American Heart Association, and those guys are continuing to study these medications, and they can actually improve those heart health outcomes. So, GLP 1 medications have demonstrated significant cardiovascular benefits. Kind of how I've said in this slide, they reduce the risk of, the heart attacks, the strokes, and any cardiovascular death within those. So, in addition to the cardiovascular benefits, GLP 1 medications are also showing strong potential in protecting kidney function. So, these medications actually help slow that progression of chronic kidney disease, which is something that is very pertinent in our times right now. And it's pretty important in patients with diabetes and obesity. With diabetic patients, their kidneys don't work as well. Same with obesity. The more obese you get, the less your organs function. We're not built to be obese. So, research has shown that about 16 to 18% reduction in kidney related outcomes include a lower risk of kidney failure and a slower decline overall. So, GLP 1 medications actually have shown promising effects in slowing the progression of chronic kidney disease and reduce these risks of serious kidney related complications as a whole, which is great. Another emerging concept is that the role in what's called cardiovascular kidney metabolic, or CKM syndrome. And this basically highlights how interconnected the heart, kidneys, and the metabolic system are, and how one medication class can positively affect all three of these. So my next slide here is coming from neurological and cognitive effects, and it's actually a really interesting area of research. I really enjoyed reading about this. So GLP-1 medications actually affect our brains. So early studies have suggested that they actually help reduce the risk of dementia. Could you imagine that? And slow cognitive decline. But it is still being studied. So this isn't like a for sure, like, hey, you're not going to get dementia if you take this, but it's also something that it's very possible, right? And so these medications also act on our brain pathways, and that controls our appetite. And that's a part that helps us lose that weight. But beyond that, they really influence reward and behavior pathways, which has led those researchers to explore their role in things like addiction and impulse control, I did not know that was a thing. And so, because of these effects, GLP 1 medications actually have been thought to have potential neuroprotective properties. So, these can help protect brain function over time. Because this is still in research, of course, it does show how these medications could benefit far beyond what they were originally designed for, obviously, diabetes and weight loss. So, GLP 1 medications may have emerging effects in the brain, but it does reduce that risk of cognitive decline and influencing the key neurological pathways. So, kind of how I mentioned in the last slide with the addictive and behavioral health concept of GLP-1s, this actually dives a little bit deeper into that. So, these are being studied for their potential role in reducing those cravings, as we've said, and it actually influences addiction related behaviors through the effects on the brain reward pathways. So, one of the newer and really interesting areas of research with GLP 1 medications is their potential role in that addiction. So, early studies are showing that these medications actually help reduce their cravings, which not just for food, but also for alcohol and even possibly drugs, which, wow, something just baffles me. Like, wow. And so, this is thought to just due to their effect on their dopamine and reward pathways in the brain, they play a major role in that addictive behavior. But by influencing these pathways, GLP 1 medications actually help reduce the reinforcing effects of certain substances or behaviors. Because of this, there's growing interest in these medications in the future to treat substance use disorders and even behavioral disorders. This research is pretty early in these stages, but it highlights how broad the impact of these medications actually could become. Here's another slide. We have some more of those emerging uses. So beyond the major areas that we've really talked about during the slides, GLP-1 medications are also being studied for a variety of other potential health benefits. So some research actually suggests that they help reduce the risk of certain obesity-related cancers, likely due to their effects on weight loss and then that metabolic regulation. GLP-1 medications are actually showing potential benefits across wide range of conditions like inflammation, metabolism, and overall health. They also appear to have anti-inflammatory properties, which in turn could make them useful in treating inflammation-related diseases. And there's a growing interest in their role in conditions like osteoarthritis and actually other metabolic disorders as well. So these medications may improve metabolic health as a whole in ways that just go beyond weight loss. And reinforcing this idea can actually help, change those widespread effects throughout the body. So here's another visual aid that I've come up with. So this graph is showing the rapid growth of GLP-1 medication market over time. So how much money these people are making. As you can see, there's a significant upward trend towards that 2022 range. 2020 there wasn't very many, and then 2022 it starts getting a little bigger, and then it's predicted by 2030 to increase a lot. And so it's largely driven by our effectiveness, not only by managing type 2 diabetes, but also promoting weight loss. And medications like semaglutides and trizeptide, they have actually become super popular nowadays. And like I said earlier, how it's going to project to a large number. It's actually going to get to 18.5% annual growth rate with the market, and it reaches about $13.8 billion between 2025 and 2023. I can't even picture that amount of money. So this really highlights how quickly GLP-1 medications are becoming a major part of healthcare and the pharmaceutical industry as well. So there are some risks and limitations to GLP-1 medications, but it's important to recognize these. So the most common side effects are GI, gastrointestinal effects. So this can include nausea, vomiting, general stomach upsets, and then especially when you're just starting to use the medication is when it gets pretty bad. There's also serious potential risks like kidney issues and pancreatitis, which is kind of interesting because kidney disease or chronic kidney disease can be assisted by GLP-1s, but it actually can cause kidney issues also. So do what you will with that information. But there's been more concern about bone density loss, which is a big deal. Another consideration is the cost and the accessibility of the medication as well. Patients are not going to have as much insurance anymore to cover these costs, and so that's going to be a struggle for them as well. So, some future implications that I've seen is that they're expected to play an even larger role in chronic disease management. Instead of being primarily used for diabetes or weight loss, they are increasingly being recognized for their benefits across multiple body systems. There's also a growing focus on personalized medicine, which that means medications can actually be targeted towards patients who are at a greater risk for conditions like cardiovascular disease, kidney disease, or even metabolic disorders as well. There are clinical trials that are trying to explore these new uses and indications, which in turn could further expand those medications and how they're used in their practice as well. Because of these benefits, though, there is a potential shift in how GLP 1 medications are viewed, not just as weight loss drugs, but as a comprehensive treatment option for a range of chronic conditions. So, in conclusion, we're just going to kind of summarize what GLP medications are, and these provide benefits across multiple body systems, including cardiovascular, kidney, metabolic, and neurological health. It's pretty important to recognize that these medications are no longer just used for weight loss, right? They're becoming an important tool in overall disease prevention and long term management of chronic conditions, eventually, we're hoping. And so at the same time, with this continued research that comes out every day, it's important to better understand their full potential, long term effects, and their safety as well. Because of ongoing monitoring, this will help ensure that these medications are used not only effective, but appropriately in patient care as well. What started as a diabetes treatment may become one of the most powerful tools in modern chronic disease management. I just want to thank you for listening to this rather lengthy presentation, but here are my sources for you, and I hope you enjoyed.